But in parallel with the thyroid accelerator pedal, we have to sort out the adrenal gearbox. Now, many people have worked this out for themselves. And, the two herbs, ginseng and ashwagandha, are very helpful for adrenal function. And for many, that's a very useful starting point. But once we get to the age, well, certainly to the age of 60 and above, our adrenal function will naturally start to decline. And my view is, from that age onwards, we could all benefit from a dose of pregnenolone. Yes. Now, pregnenolone is the most upstream of all adrenal hormones. So all adrenal hormones, as you know, start life as cholesterol. Yeah. And guess what? The higher your cholesterol is, the longer you live.
Yes, absolutely. It's lovely to hear somebody saying this. He said, oh, bullshit. No. Carry on, loving it.
The next port of call is cholesterol goes to the adrenal gland where it's converted into pregnenolone. And all the adrenal steroid hormones are downstream of pregnenolone. And it's also been dubbed the memory hormone. From pregnenolone, we make DHEA, highly protective against osteoporosis. And we also make cortisol and testosterone and some estrogen and progesterone. So it's a very important mother hormone of the adrenal glands. And thankfully, it's inexpensive. 50 milligrams sublingually under the tongue daily is going to protect your bones and protect your brain and certainly help your mitochondria.
And you think that's way superior to DHEA?
Well, it's upstream of DHEA. So it's converted to DHEA. We don't have, with the thyroid gland, there's a very well worked out progression to sort out the thyroid. It's not so straightforward with the adrenal glands. It's much more a case of suck it and see and trial and error. And for some people, it's pregnenolone. Some take maybe 25 milligrams of pregnenolone and 25 milligrams of DHA because they respond better to that. Some take ginseng and ashwagandha as well. Some use licorice. So it's much more trial and error. I give a few clues, in my book, the thyroid book, as to how to go about that.
Please give us your website, and we'll give it again at the end. But where can people go and find your books? What is your website, Danny?
Oh, it's just drmyhill.co.uk. I checked the other day; it's had 25 million hits. So I'm rather pleased about that. So it comes up right at the top of the Google search engine. So if you put in Myhill as opposed to Your Hill, you'll find it.
Right. Okay, and I will have it again at the end. That's what I slipped my memory. It's because it wasn't a question. I wanted to invite you to boast your website, and why not? It's wonderful. It's loaded with data. All right, where are we next? What's next?
So when we've got those things in place, i.e., the 4 aspects, we've now addressed, as I call it, energy delivery mechanisms. Yeah. And then we have to look at the inflammation side of things, because inflammation occurs when the immune system is busy. Now, the immune system may be busy for very good reasons, i.e. you've got an acute infection that it's fighting, or it may be busy for very bad reasons, such as allergy or autoimmunity. Mm-hmm. And of course, you are also an allergy expert, and the common foods that drive allergy are grains, gluten grains, especially, and dairy products. So the paleo-ketogenic diet is not just a low carbohydrate diet, it's also free from dairy products and free from gluten grains, and that covers many of the allergy bases.
I've often wondered, whether using the Stone Age diet, the caveman diet, whatever. The BBC introduced me once as the Stone Age doctor. I said, well, that's not fair. I only have a few grey hairs, I'm not that old. But I often wonder in the years since, whether the extreme exclusions, which mostly excludes manufactured food, carbs, dairy and things, and of course sugars by choice, whether it really worked that well as a keto diet as well as an allergy exclusion diet. Any
well, it's the starting point. The Stone Age diet was not low carbohydrate. And as we both know, carbohydrates are incredibly addictive. Once you start eating them, you can't stop. And the Stone Age diet did produce fruit, and of course, did allow fruit. And of course, fruit is high in sugar. It did allow
berries. No, I used to say berries are pretty low in sugar, and I don't have bananas and figs, but you're fine with berries.
Granted. But potato and rice, which would be permitted on, and sweet potato, which would be permitted on a Stone Age diet, they could be quite carby. Mm-hmm. And the carbohydrate addicts sniff out the carbs. They will find any excuse they possibly can to rationalize their consumption of carbohydrates, because in the short term, they give you an energy hit. Mm-hmm. And we know that. I mean, it's called comfort eating, isn't it? When I worked in Nottinghamshire, the comfort was a chip butty, putting white bread.
Yes.
My sister up in Scotland said it's a deep fried Mars bar.
I was going to say deep fried Mars bar. Yeah. You took the words out of my mouth.
So we know what the addictive carbohydrates are, and people, because we don't appreciate that they're addictive, we eat them because we think it's okay, because everybody else does that. We're carbohydrate addicts, en masse. And the awful thing is we foist our loves on our children. We love that food, so we feed those foods to our children. And as a result, children have never eaten a worse quality diet than they do in the modern Western world. It is absolutely shocking. So yes, back to inflammation, and allergy is a key point, a key player. Once you take out the major allergens like grains and dairy, it's usually fairly obvious what that person is allergic to, because if you eat a food infrequently, you get an obvious reaction to it when you do. And people come to me and say, oh, yes, I don't have oranges because they always give me migraine. Oh, I never eat eggs because I get irritable bowel syndrome. Oh, I don't eat fish because I get a rash. It's obvious.
Yes. Not a hidden allergy, in fact, then. Yes.
Correct. They become unmasked effectively.
Yes. Oh, it's taking me back.
But the real issue, of course, for many people with post-viral syndromes is that virus is persistent. It's still there in the body. And, of course, the most pernicious one of all, I think, is the Epstein-Barr virus. Yeah. It's carried by 90% of us because it's we all pick it up in teenagers. It's called the kissing virus because it's acquired from saliva from others. And guess what we all do as teenagers? We're all exposed to it, and we all get Epstein-Barr virus. Now, if you've got an immune system which is got plenty of energy and it's well nourished, then you will see that virus, tuck it away in the body, forget about it, and it won't trouble you evermore. But if you've got a poor immune system, if the immune system is immunosuppressed because you're stressed at university, you're away from home eating a poor quality diet, you're working long hours and missing out on sleep, you have stressful, whatever, the immune system will be suppressed, and then that virus will prevail. And it will live at a low level in the body, driving inflammation, and, as I call it, kicking a hole in the energy bucket. The immune system is our standing army, and we know that armies require a huge amount of energy. And if that army is busy, fighting a low-grade infection, then that's going to drain our energy bucket. And the inflammatory symptoms make us ill. The French have a word for it, malaise. We feel flu-like, we feel under the weather, we've got aching bones, low-grade arthritis, maybe low-grade gut symptoms, maybe foggy brain, depression. These are all inflammatory symptoms and accompany and are part of the clinical picture of somebody with a post-viral syndrome, a long COVID syndrome, ME, or whatever.
Right. Now, I don't have your list, sweetheart. Are we, at the end of that, can we go and move on to talking about low cardiac output?
Okay.
Some of the remaining times.
Okay, now this comes under the energy delivery department problems. Because if energy delivery mechanisms are poor, then the heart cannot beat powerfully as a pump. Now, normally at rest, the heart beats, about 70 to 72 beats per minute with nice strong beats, and we maintain a blood pressure of maybe 120/80. That's a typical situation. Now, if energy delivery to the heart is impaired, and of course, as part of that, the mitochondria will be going slow, then the heart cannot beat powerfully. And so the first thing that happens is the blood pressure starts to fall. And it's very common with people with fatigue syndrome to have low blood pressure. Now, to compensate for that, the heart tries to beat a bit faster. And therefore, we often see a tachycardia at rest. It's maybe going 80 or 90 or 100 beats per minute. Now, the situation becomes critical when we go from a lying position to a vertical position. So, of course, most of my very sick fatigue syndrome patients who are maybe functioning at 20% of their full potential, they can only function lying down because the heart doesn't have to work so hard. It's much easier to pump blood on the flat than it is in the vertical position. Now, and even on the flat, they'll have low blood pressure and maybe a tachycardia. Now, when you stand up, you're then pumping blood uphill and down dale. You have to increase cardiac output by about 20%. Now, if you haven't got the energy delivery to the heart to do that, then you cannot increase cardiac output by 20%. You can't beat 20% faster. The heart's already doing its best. So in the short term, it tries to beat faster to maintain cardiac output, but that too is unsustainable. That too is demanding energy. And eventually the blood pressure drops precipitously and that person falls over. It's got a terrible name. It's called postural orthostatic tachycardia syndrome. And that is a clinical feature of people with very poor energy delivery mechanisms. But of course, there's a secondary issue here, because if energy delivery mechanisms are poor and cardiac output is reduced, then you're not going to be able to fuel your mitochondria from the bloodstream with the oxygen and the fuel that it needs. So then mitochondria go slow for a second reason. The blood supply isn't adequate. So, if the heart isn't being powered, that has very severe impact. In fact, actually, these patients are in heart failure. And what's so interesting about this is we can then use this information to treat patients who are in heart failure, elderly patients in their 80s and their 90s who've been told, oh, you've got heart failure, there's nothing we can do about it except give you some drugs to control the symptoms. And guess what? We can reverse their heart failure with all the interventions we talked about. Ketogenic diet, basic package of supplements to support mitochondria, CoQ10, magnesium, and all that sort of stuff, detox regimes. The life expectancy of somebody with a diagnosis of heart failure is 2 years. I now have many patients with heart failure for whom their heart failure has been entirely reversed by the very interventions we've been talking about today, and are alive and kicking and well today.
And years way beyond the 2 years. Yeah. Well, if you said it's the condition's gone anyway.
Correct.
Pretty powerful.
And what this medicine also does, what we now also know about mitochondria is they are responsible for our longevity. Now, I'm enjoying life. I'm 65. I want to live it to its full potential, doing all the things I love doing, and that demands energy. But so I do everything I possibly can to look after my mitochondria now, because I want to live into my 80s and my 90s and so on. There's an old boy I look after who lives in my granny flat. He came to me about 7 years ago. Of course, I feed him a ketogenic diet, and he does exercise every day. And next week we will celebrate his 101st birthday.
Way, whoopee!
And he has no dementia, no heart disease, no cancer. He really is an inspiration to us all. And even Tony says it's Sarah's diet that makes the difference.
Wonderful. All right, tell us what are Q scores? I came across that on your website, and it's related to this heart output thing, isn't it?
Yes. Well, this was some work that was done by Arnold Peckman in America, and he was asked by the National Institutes of Health in America, we want to test for people with chronic fatigue syndrome. What can we do to know who's a hypochondriac and who's a mitochondriac? And he looked at these patients clinically, and he looked at their fast pulse, he looked at their low blood pressure, and he said, these patients are in heart failure. Let's measure their cardiac output. Now, he developed a very non-invasive method of doing that, and called impedance cardiography. And basically he demonstrated precisely that the sickest patients have the lowest cardiac output or the lowest Q score, and vice versa. So again, it was a fabulous objective test of heart function in patients with severe fatigue syndrome. Of course, we don't have this test available to us in this country. The reason for this is that the conventional doctors have no idea how to go about treating chronic fatigue syndrome and ME, because they're not looking for causation. And worse than that, the insurance companies, the pension companies, again, they don't want chronic fatigue syndrome to become a physical disease, because then they'll have to pay out. So by making chronic fatigue syndrome and ME a psychiatric disorder, for which, as you say, you just need some antidepressants, some great exercise, and pull yourself together, they trivialize it, and they save themselves from having to pay out what these people are properly owed. So they deny it's a physical condition, they make it psychiatric, and that is deliberate policy.
Wow, I never thought of it that way, but yeah, as soon as you say it, ting-a-ding-a-ling, it rings all the bells, doesn't it? Now, Dr. Paul Cheney, does he tie in directly with this, or shall we end off about that? I thought he did, yes.
Funny enough, I at the Better Way conference that was run in Bath a few weeks ago, I shared a stage with Dr. Paul Cheney talking about chronic fatigue syndrome and ME. And as you rightly pointed out, he is a great advocate of vitamin C. Now, vitamin C is one of my favorite multitasking tools because you and I know that doctors are not going to be able to help these patients. They're not thinking causation. So my job is to give, as I call it, people the rules of the game and the tools of the trade so they can do it themselves. And the joy of vitamin C is it does so many jobs. Now, what Paul Marek has demonstrated is it's very good at killing infections. It's markedly antimicrobial. And he was using it, as you explained, in ITU setting. He was in critical care in ITUs, where with patients with septicemia, which of course is a killer, even with steroids, antibiotics, oxygen, ITU care, the mortality was about 40%. By simply adding vitamin C into the regimes, he reduced the mortality to 1%. He made the comment that anybody who dies with septicemia dies with scurvy because they've used up all their vitamin C. Vitamin C is literally the bullets with which the immune system shoots infections.
Yes.
So vitamin C is extremely important, and I like all my patients to take vitamin C. In fact, I think we should all be taking vitamin C because we don't make it ourselves. So, my little dog is sitting next to me. All other mammals, dogs, horses, cats, sheep, cows, they can create their own vitamin C from simple sugars.
So they don't get colds.
Correct. Humans lost that ability some millions of years ago. So we have to eat the stuff. And my view is we all need gram amounts of it daily. So at least 3,000, 4,000, 5,000 milligrams of vitamin C every day to keep us free from infection, to detox, good, important for antioxidants, to kill microbes in the upper fermenting gut, and so on. It performs many brilliant tasks.
Right. Now, sweetheart, I don't want to embarrass you. It's my mistake. But actually, I said Paul Cheney. Dr. Paul Cheney, not Marek. Marek is the, just explain to you. Is Paul Cheney's work part of the cardiac output story?
Correct. Well, he was basically echoing the work of Arnold Peckerman. He demonstrated that patients with fatigue syndrome were in this state of low cardiac output, and he ascribed that maybe to viral infection of the heart muscle, but he also talks about mitochondrial issues. Right. Now, one of the other interesting aspects of if the heart doesn't beat powerfully as a pump is you can blow open the foramen ovale. Now, let me explain that because I've jumped a mile ahead of myself.
Yes.
When babies are in the womb, they have a single circulation. The blood goes from the heart, round the body, round the lungs, and back to the heart again. It's a single circulation. Now, at the moment of birth, the circulation has to change to a double circulation. It has to change so the blood goes from the heart round the lungs to get oxygen, and then round the body to supply oxygen. Of course, in the baby, it goes round the body to the placenta where it loads up with oxygen and then back round the body. So at the moment of birth, the single circulation becomes a double circulation. And for that to occur, there's a hole in the heart that has to be sealed up. It's called the foramen ovale. Now, actually, that's not a hole in the heart. It's actually a flap. It's actually a letterbox. It snaps shut at the moment of birth, and without going to the details of it, we then have a double circulation. Now, what snaps it shut is the pressure difference. The pressure difference on the left atrium and the right atrium. The pressure is high in the left atria compared to the right atria, and that's the pressure that holds that valve shut. Now, what happens in some patients with fatigue syndromes is that if the muscle doesn't beat powerfully as a pump, then that pressure difference is not so well marked. And if that flap hasn't sealed down completely, it can blow open. And what that means is blood is shunted from the right side of the heart to the left side of the heart. It doesn't circulate round the lungs. It doesn't pick up oxygen. It doesn't drop off carbon dioxide. And of course, that's very bad news. That alone will cause severe fatigue. And that's what Paul Cheney demonstrated, that many patients with fatigue syndromes have a patent foramen ovale. Now, I have to say, that doesn't change management very much. You're certainly not going to go and have surgery to stitch that foramen ovale down again. That's not an option. What we have to do is make the heart beat more powerfully again, because if the heart beats powerfully, that restores the pressure gradient between the left atrium and the right atrium, and the foramen ovale snaps shut and stays snapped shut. But my guess is what very often patients describe to me is, they're just trickling on and they're not too bad. They're a little bit on the edge thing. And then suddenly they dive down with devastating fatigue. And my guess is that is the point at which the foramen ovale suddenly blows open. Suddenly you're not circulating blood around the lungs. And of course, you're going to get an acute fatigue because you cannot supply your mitochondria with the fuel and the oxygen that they need.
Can you back that up with oxygen tension, plethysmograph or oxygen tension studies? It's a fascinating idea.
Well,
Cheney do it, or you, or somebody?
Well, that's not that's not strictly relevant because it's complicated physiology, but all this has to do with oxygen delivery. So let's just talk about that briefly, because again, this is something that can be easily fixed.
Yeah.
Oxygen obviously gets into our body via the lungs. In the lungs, it hops onto hemoglobin, where it's carried around the body to where it's needed, to the mitochondria, and oxygen then hops off hemoglobin and supplies the mitochondria with oxygen. But the question is, how does oxygen know how to do that? How does oxygen know to stick onto hemoglobin in the lungs and then jump off hemoglobin at the mitochondria? And the answer is carbon dioxide. It's all about acidity. Now, carbon dioxide from mitochondria, which is generated as a part of energy delivery mechanisms, that carbon dioxide dissolves in the bloodstream to form a weak carbonic acid. And if the bloodstream is slightly acidic, then oxygen jumps off hemoglobin to the mitochondria. By contrast, in the lungs, where we are exhaling, there's less carbon dioxide. Carbon dioxide comes out of the bloodstream, and therefore the bloodstream is more alkali. And where the bloodstream is more alkali, oxygen sticks onto hemoglobin. And of course, that's a totally desirable state of affairs. I mean, if it was the other way around, we'd be dead very quickly, wouldn't we?
Yeah.
So it's all about carbon dioxide that determines oxygen delivery to the tissues. Now, you may have heard of Buteyko. Mm-hmm. Buteyko was a great advocate, correct, of breathing.
Breathing slowly instead of deeper.
Correct. And what Buteyko realized is that oxygen delivery is dependent on carbon dioxide. And many people, especially when they're stressed, they hyperventilate, they wash carbon dioxide out of the bloodstream. So all the bloodstream becomes a little bit too alkali, and therefore you cannot deliver oxygen to the tissues. So you can have a pulse oximeter reading that shows your blood is 100% saturated with oxygen. But if it can't get to the mitochondria, it's not doing any good. So you can't demonstrate, poor oxygen delivery to the tissues just by measuring oxygen in the bloodstream. It's all about carbon dioxide. Now, so so there are very simple exercises that can be done. They're called the Buteyko exercises, which is first of all to nose breathe, secondly to slow your breathing down, and thirdly to use your diaphragm for breathing, which also helps venous return, incidentally. And those are three things you need to do. And to test, to see if you've got your breathing right, you measure what's called a controlled pause. So you wait until you're breathing normally, at rest through your nose, and then you just stop breathing. And you see how long you can go before air hunger cuts in, and you've got to take a breath.
I can't get much above 20 seconds myself.
Well,
I'm sure it's not very efficient.
In that case, you're probably hyperventilating. It should be at least 30 and probably 40 seconds. So when you are doing the breathing exercises, what you are doing is you are changing the sensitivity of the respiratory center in the brain so it tolerates more carbon dioxide. And at that point, a controlled pause of 30 or 40 seconds is very doable. And of course, the greatest exponent of this is Wim Hof, who does the most extraordinary things and the most incredible achievements. He controls his breathing, his heart rate, his body temperature through breathing exercises and meditation and cold plunging and so on. And you've probably all seen the most incredible. He walked up Everest in a pair of sandals and boxer shorts.
I didn't
because
see that, no.
he's able to control his body temperature through the techniques that he describes. So this is all very doable. These are all tools of the trade that anybody can employ to good effect.
I got the physiological story you're talking about from a girl called Alexander David Neal. She was one of those Renaissance women in Victorian times and went to Tibet, and she ended up meditating with the monks in a cave at 18,000 feet, 40 below, wearing just a simple robe and a pair of knickers, and obviously they're using the same mechanism as you described, and they can handle it. It's amazing, isn't it? Amazing what the body can do. Sarah, I'm going to stop. You've painted a picture of the most amazing doctor with a profound fund of knowledge, like real stuff that people really need to know. Why are these jerks in the General Medical Council trying to unseat you? It's crazy. They should set you up as professor of the board and teach all our medical students this, please. But don't hold your breath.
Well, the answer to that is follow the money. And our medical regulators are all driven by Big Pharma. In fact, as we speak, I'm in the process of setting up an alternative medical council, an ethical medical council. And we're building this website called Freedom Health Connect. And the idea is that doctors can sign up to this, and when they are part of this, they won't be they won't call themselves doctors, they'll call themselves educators or providers. Because my job, and of course the word doctor, it comes from Latin, it means teacher. To teach, docere. And my job is to teach people to look after their own health. And therefore, by practicing within Freedom Health Connect, essentially we are practicing tribal medicine. So we're coming under the jurisdiction of tribes in Indian tribes in America, Maori tribes in New Zealand, Aboriginal tribes in Australia, who have their own tribal medicine. So that puts us outside the jurisdiction of big pharma-driven regulators. And it also puts us outside the jurisdiction of expensive insurance, because I'm not prescribing anything for my patients. I'm teaching them how they can cure themselves. And therefore, I'm not responsible for their health. They are. I'm the teacher. So this is going to make and any doctor who signs up has to reaffirm the Hippocratic Oath and has to reaffirm that they receive no vested interest in any of the treatments that they're recommending, i.e. they're not receiving backhanders from Big Pharma or from medical investigations or whatever. So this will mean that people will be able to access truly independent doctors who can speak their mind without fear of being struck off by the GMC or by the American regulators, and learn proper medicine. So Freedom Health Connect, look out for it. It's going to be a great thing in the future.
I'll have you back to talk about it as soon as you're ready, as soon as you're launched. Please repeat your website, sweetheart, and then we're done, yeah?
Just drmyhill.co.uk will find me.
Well, of course, it'll be on the page with this, but Myhill, Myhill, Myhill. Yay. Thanks so much, Sarah. You've been wonderful, and I don't know why it's been so long. I should have had you on 20 years ago talking to my tribe, as it were. Anyway, great fun and wonderful to connect with you again and stir up some of the nostalgia from old times. It was great. Thank you.
Lovely to see you too, Keith.
Thank you very much. Bye.